going to come right into here. So in this case here, I'm way high into the axilla with my hand. And this other hand is going to be down here at the distal lateral arm. That way I can use as a leverage point. Because I'm going to take this hand that's into the axilla and pull it laterally. And then I can also use this just to stabilize or push that medially to get that extra leverage to pull that out lateral. So you can see that's bringing the head of the humerus in this lateral direction. So the first thing I want to do is establish what a grade 2 sustained movement is. That way I can gauge how deep my other mobs are going to be. So I'm going to take this out in the lateral direction until I feel there's my resistance of the joint capsule space. And when I feel that resistance of the joint capsule space, that tells me that's my grade 2. So now I can figure out, hey, this small movement here is my grade 1 sustained. This movement here, back at it, is my grade 2 sustained. And then this movement way over here, stretching the joint capsule, is my grade 3 sustained. Cool. That also allows me to establish this is my grade 1 oscillating. You guys can't see it. I can't see it. I feel it. She feels it. My grade 2 oscillating. My grade 3 oscillating. You okay? And then my grade 4 oscillating. Cool. So that can be done in that neutral position. I can also do this in various degrees of flexion. Various degrees of flexion. Various degrees of flexion. I can also do this with various degrees of abduction. Cool. So let's first start this off neutral, hand down by the side, and then we'll take this into different flexions. We'll take it into different abductions. We'll turn over. We'll take it into extensions, things like that. Sounds good? So let's start with this very neutral that allows, see that GH external rotation to take place. But I also want to keep my distraction component. So bang. Right? Whether it's oscillating or sustained. You okay? We can do in prone as well. So I'm going to have you turn over. And this one's not going to look much different. Right? If it's just a stable movement and I'm not doing range of motion with it, in this position, take it to its point of limitation or its point of pain. There's my abduction or my distraction. And then here's my inferior glide, grade 1, grade 2, or grade 3 sustained, or grade 1, 2, 3, 4 oscillating. And then again, it's easier this way. And yep, and then again, I can start to do that with my ranges of motion. So if I got a limitation here, maybe this is where I really want to focus on that range along with my glide. We already worked out the distractions with our abduction. So I already know that I want to distract it with this abduction, right? We were using this to stabilize, but I can't use this to stabilize at this point because I need a hand to take this anteriorly. So in this case, I'm just going to use this arm here to pull into my abduction. If I wanted to, I can do one of these. And then from here, this is going to go straight anterior. So here's my distraction component. And then here's my anterior glide, right? Pain reduction, low grade, higher grade to increase the joint space. Now I can also couple that with the movement of horizontal abduction. Distract, anterior glide, horizontal abduct. Distract, anterior glide, horizontal abduct. And it doesn't always have to be a sustained. We've been doing it as sustained, but can this be an oscillation as I bring it through the movement? Absolutely. Cool.